Good morning, ladies and gentlemen. So because the electricity has been out of order, so they're very hurry in repairing it. So I just talk without microphone. Can you hear me? Okay, thank you. So I think general introduction of internal medicine. This is the first time for you to going into clinical practice for the Nanshan Ban, right? So first of all, I suppose, what is the internal medicine? I think internal medicine is basic discipline of the so-called the clinical focusing on the cause and the pathogenesis and diagnosis and treatment and prevention as a whole of the human diseases. So this is very difficult to understand. Let me give you some cartoons showing that. So actually, just first of all, I give you some example. This is a patient. I saw that 10 years ago. That was the SARS outbreak, right? So you are in the Chuzhong. You are still in Chuzhong, right? So, no, okay. So this is the first patient I saw that. So we don't know what's happening, what was happening in those patients, in this patient. And this is Mr. Guo, age 41, and he had got a fever and fatigue and myalgia for 3 days, and then took an X-ray showing that it's a pneumonia. So in Heyuan, the county, and then just give them some antibiotics. There's no response. The symptoms getting deterioration. So this patient was referred to the Guangzhou Institute or Spiritual Diseases. And this is, of course, the first affiliate hospital of Guangzhou Medical College. That's next month we'll call that Guangzhou Medical University, right? Okay. So that's the time of 22nd December 2002. This is 10 years ago. What happens to this patient? What's the symptoms? Myalgia, and then headache, and then got dyspnea, the short of breath. And what's the signs? And the respiratory rate is pretty high, and mid-cyanosis, 子干, and the heart rate is pretty fast, and there's no murmurs, and the lung shows during examination shows normal. So chest X-ray show bilateral. In particular, in the left side, so the patchy infiltration showing that, just like this. So you see, this is first, and then second day, it's getting progress very fast. So this patient is really in a serious position, right? So, and what happens? This is in chest CT, also showing the same thing, massive patchy infiltration shadow over the bilateral middle lower lungs. So this patient, what's the laboratory examination is showing the white blood count is normal, in the normal range, and the differential count, neutrophils not so high, not like a general infection. And lymphocytes are normal, and the red cell count is normal, and hemoglobin is normal. And the sputum culture shows there's no bacteria inside. So the patient now, up to now, we've got some history. The patient's complaint, and then we after an inquisition or inquire or interrogation, 问诊, and then got some data. And then on the other hand, we give some physical check-up, and then find some signs. And also with some laboratory and radiology examination. All data collecting together, we got a primary diagnosis. Okay? So now the primary diagnosis. Of course, we need to exclude other diagnosis. So this is so-called differential diagnosis. I'll tell this later on. And as needed. And then make a diagnosis and then go into the treatment. So because the patient, there's no time to give a lot of differential diagnosis, because the patient the situation is very serious, 很严重. So we give give him some, after the primary diagnosis with pneumonia, 肺炎, we gave him some antibiotics, ofloxacin, azithromycin, and clindamycin, and so on. Very formal, very regular use. But 3 days after the administration of antibiotics, the patient getting deterioration, just getting worse. So we should have to think about whether the diagnosis is correct or incorrect. Okay, so this is going back to the thinking way. So it shows ineffective. So we have to be back to differential diagnosis. So we have to do other examination. We have to ask the history, and we have to do some tentative treatment and see what happens after treatment. So this is what we exactly are doing. So next we have doing some bronchoscopy. So 支气管镜 and take the biopsy, so 活检, and showing what happens in this patient. And you can see here you have learned some biology, pathology. This is a typical pneumonia with neutrophil infiltration. 中性粒细胞群生. This is a typical bacterial pneumonia. However, in this patient, we cannot see this typical change. What we can see is here, you can see here. So, this is a lot of fibrosis, 纤维化, and also this alveolar with some hyaline membrane covering the alveolar. So, transbronchial lung biopsy under fiber optic bronchoscopy showing not many inflammation cells, matrix cells, so intra-alveolar hemorrhage, and also hyaline membrane covering the alveolar walls, and also fibroblast proliferation, 增殖. That's different. So from pneumonia. So this is one thing we have to ask about. And then, so we just inquire his history and follow up. And within the first day from the onset of the diseases, 3 close contacts, the family members or medical staff, so develop similar symptoms. Okay, we suppose this disease will be of some have some character of contagious infection, infectious, 传染性, have this character. And that's the second point. And the third point, we just give this patient some tentative use of corticosteroid, 皮质激素, by using this dose, and then found this, so that because we suppose this patient, just like the internal medicine, the so-called ARDS, so acute respiratory distress syndrome. So we just use some corticosteroid at this time. And then the patient the next day showing some very much improvement. We were very surprised about that. What's the patient about that? But after collecting all kind of data, and then we make some further diagnosis. Perhaps this patient is. Oh, thank you. Right, I should not be speak so loudly. All right. Okay, thank you. And then further diagnosis showing, okay, this patient actually was having pneumonia, but probably it's not bacterial, will be maybe virus. But from the clinical phenotypes, it shows acute respiratory distress syndrome. This is a well-known syndrome. So, but still not get diagnosis. But at that time, 10 years ago, that's real story. And 10 years in Zhongshan there happened some other outbreak of 14 people get the same thing. So that's at that time, so the Department of Guangdong Public Health, Guangdong 卫生厅, to set up a document. That was the 23rd January 2003. And say the outbreak of unexplained pneumonia. At that time was just called unexplained pneumonia in Guangdong. And the close contact history, the character is infectious or contagious or flu-like symptoms or signs of pneumonia under the X-ray, and then white blood count is normal, and antibiotics no response. So people will be paying more attention to those kind of pneumonia. But we still don't know what's happening. So what's the pathogen? What's the cause? No. So 病原学不知道. So at this time we are doing some research at the moment, but surprisingly in the middle of February in Beijing, there's a news coming from the central broadcasting station, from the People's Daily and the central TV station. Wow! So after some autopsy, so 尸检, they have found the pathogen was so-called chlamydia, 衣原体, and then they also emphasized very effective with the directive antibiotic treatment, but should be given with a full course, adequate course of protocol. So we were very surprised about this result, and they showed us. So that's the atopy, and under the electron microscope, and have found some particle which is mimic to chlamydia. So, but we still keep going on our research after some fluorescence microscopy, and then actually we had found as a cooperation with Hong Kong and some other doctors in Canada and the United States. Actually, eventually we have found the pathogen is SARS coronavirus, SARS 冠状病毒. This is the pathogen. It's not chlamydia. So, and also this patient after this onset, we can detect the antibody, SARS coronavirus antibody, by fluorescence imaging. So at this time we have got final diagnosis. The pathogen was SARS coronavirus pneumonia, and the clinical type is called SARS. That's defined by the WHO. So, and how we were doing to this patient. We had a therapeutic principle with the rational use of corticosteroid, rational use of non-invasive ventilation if the patient get the hypoxia, and also rational use of antibiotics, in particular in dealing with the secondary infection. Okay, so after this kind of treatment, after a whole year, the Guangdong, the survival rate, this is mortality, the death rate. So we, among the world and different countries and areas, we got the lowest the mortality, the death rate, the best survival rate. So going back to this history, so we should think about what's the internal medicine. So we should get some data from patients' complaint. We get, after the inquisition, also inquire or interrogation, or physical checkup and laboratory and respiratory data, going some primary diagnosis. And after very special differential diagnosis, and got the diagnosis, and then get the treatment. And the final diagnosis will only be given if the patient had a good response to the diagnosis. So this is the whole series of internal medicine. So I just tell the concept about that. So next, I would like to talk a little bit about the progress in internal medicine. This is extremely important for our young doctors, because you are the future world. So how do you grasp the progress in internal medicine? So the first point I would like to mention about the transformation of development of medicine models. I think you have heard about a lot of this, and I gave you a talk about this. So we should nowadays, the medicine models coming from biomedicine model to the biopsychosocial medicine model. Okay, So this is a biomedicine model. The doctors are more concentrated on the pathophysiological process, only on the management, the so-called somatic, 躯体的 diseases, rather than the whole things. So we will transfer into the so-called, we should be paying more attention to the mental status, the lifestyle, and the social factors, and so on. So this is one thing, a change of the medical models. As you know, nowadays, what determines your health, including you in the audience. So as you know, internal factor, the heredity only consists of 15% of the health. And of course, some others, external factors, social environment, or natural environment, and also the medical condition, so your medical care is good or not. So this all together will be only 32% of your health. So in other words, which one is the most important for you to develop yourself, to have a better health condition? So the most important is lifestyle. That was selected by yourself. Right. So as a doctor, you have to think to teach the patient about that. So what kind of lifestyle? One is healthy diet. So you should have some healthy diet, rather than just quite a fat people still got a lot of oil. It's a really very delicious food and so on. That's the first one. And the second one, you have, of course, everybody knows. So I insist on, even now, proper exercises. So that's very important for the person. And the third point is stop smoking. So not that some of the people, so from the very, I don't know whether it is true. So from the baby, they smoke a lot. So smoking and drinking, some, even Coke. So not drink too much. That's the third point. And the fourth, mental balance. Not showing very much anxiety, so always angry from time to time. So that's 4 points, very important. If you can keep this 4 points very good, I think that the result will be, you can reduce the hypertension for 55%. So whether you believe that, so up to you. So cerebral infarction, 75%. Diabetes, 50%. And tumor, 33%. So a correct lifestyle is very important. This is according to the modern medicine model. So, okay. So the model, so people just mentioned 4P model in the nowadays. I think I have given some talk to you. So predictive, preventive, personalized, or participatory. So that means it will be early prevention, early diagnosis, early intervention, and also should give the patient personalized and should be participated by the public and the community. So actually, my feeling is just going to just give you some example. For example, this is a patient with severe arteriosclerosis, 冠状动脉硬化病, and eventually he actually developed rupture of the heart because of the blood vessels rupture, and also if the rupture happening in the brain, that will cause some brain hemorrhage, and that's too late. The patient will die immediately. So it's too late for us. So we have to go a bit earlier, upstream. So like this. So as you know, this blood vessel, this is the diameter. It's quite open, quite small, quite normal, and then gradually narrowing, gets smaller, smaller, smaller. And that symptoms will not happen even here. So you can see 50% occlusion, there's no symptoms. So 70% occlusion, for example, in the neck and carotid artery. And then the patient will feel dizzy, So a little bit dizzy and numbness. And if the femoral 这个股动脉, they will cause some numbness of the hand or feet. If it is really 90% occlusion and stroke and hemorrhage will be happening from time to time. So we should make some early diagnosis and prevention in the early stage rather than to the late stage. That's extremely important for us. So this is why in nowadays we have some medical reform, medicine reform, 医改. So up to now in the majority of the hospitals, we just very much concentrated in treatment after symptoms occur and even rescue for emergent, putting in the ICU. And of course, we are not very concerned about the early prevention and early diagnosis and treatment. But for you, in the future, you have to do that. So as the whole series, the medical costs will be increasing as the disease getting deterioration. So this is not a right way for us. So what's the right way for us? You can see we should pay more attention to the early prevention and the early diagnosis and early treatment. So by this way, the medical costs will be going down. So this is one point I should mention. So the update medicine model, I make some modification. 4P change into 5P. That's including the pre-symptomatic. In other words, this patient, you have found some abnormality by examination. You had to treat the patient. So you should not, perhaps, if you let the patient go, so will not treat it until the symptom happens. That's maybe too late. I'll give you some later on, the example later on. That's the first point about medicine, the model. The second part will be we have to develop some evidence-based medicine, 循证医学. That's extremely important. So medicine in the Asian time is a basic, purely empirical, 经验医学. In particular, nowadays in 中医, still a lot of empirical medicine. We need to change it to evidence-based medicine. So evidence-based medicine, I took a sentence like this: the diagnosis and treatment, prevention and rehabilitation, 康复, are established on the integration of the current best clinical evidences. So, and the professional knowledge and skills and the patient's needs. So that's very important for us. Patient needs, and we have some techniques and to prove it's useful. It's true. It's not based on the imaging. So this is why very much common to use this method, the so-called this is a special clinical trial. We call that prospective, randomized, double-blind, control, and multi-center methods used to collect systematically large samples from which the objective evidences are achieved and consider as a foundation of medical decisions. So this is extremely important for us. This is method you have to get it. So for example, so I just now saying the traditional Chinese medicine. So I insist on talking with my traditional Chinese doctor and said you have to carry on some sort of evidence-based medicine rather than empirical. 师父带头地. It's not it's a way, but not the perfect way. So, for example, it's the only time, only in the recent years, some of the traditional Chinese medicine can carry on some evidence-based medical study. For example, this one, a natural herbal medicine, a medicine for the management of H1N1, 新甲流, and see if it is working or not. So that's a double-blind positive control clinical trial. What's control? It's not placebo control. The positive control by using oseltamivir. Everybody knows that. Dafei, oseltamivir is very effective in the management of H1N1. They've got 244 patients have typical H1N1 infection because they had examined the throat and find by doing PCR to detect H1N1 virus that's positive to prove it is really the case. And using 莲花清瘟胶囊, and in the first group, and the second group using oseltamivir in the second group, and primary endpoint to compare from each other whether it also improvement or so on. This is some elements of the that's quite common element of this 莲花清瘟胶囊. And this is into two groups. And what's the result? So if we look at this symptom-free over time, so you can see this 莲花清瘟胶囊, this is oseltamivir. The tendency is similar. So in some point, it's even better. 莲花清瘟胶囊 as a whole, that's similar. I'm not going to talk too much about this. So the conclusion is compare with the oseltamivir. 莲花清瘟胶囊 yield similar therapeutic efficacy in reducing illness, the fever, and also viral shedding duration. That's viral load shedding. 这个病毒的载量在血液里头减少can have this effect. And there also 莲花清瘟胶囊 might be an alternative therapeutic measures for H1N1 virus infection. This is the result. I think quite convincing. So this is why when the patient had H1N1 infection, they don't like to eat oseltamivir. It's expensive. So I introduced him to take this 莲花清瘟胶囊. I think that's quite convincing data for me. So that's the third point. The third point of the concept is accelerate the development of traditional translational medicine. So doing some basic research into the clinical practice. That's very important nowadays in the world. So as I just give you an example. This is the patient with chronic obstructive pulmonary disease, which is very high mortality and prevalence in China or over the world. So they have a lot of symptoms and so on. So we have found doing some mechanism of this kind of diseases. So after smoking and also air pollution, just like nowadays in some of the cities in China, they will cause some they will produce a lot of oxygen-free radicals, 自由基, and some nitrogen-free radical, 氧自由基, 氮自由基, and then damage the lung, and then initiating the so-called oxidative stress, 氧化应激, and then causing some inflammation, and then to damage the airway and alveoli. I'm not going to talk too much about this, but we have found, so in the basic research, we have found some compound containing thiol group, 硫氢基, because this is reduction agent, 还原剂. They can inhibit the oxidative stress, induce the inflammation. I have done some, in my group, we have done some laboratory work in animal and finding this one point is called acetylcysteine, 乙酰半胱氨酸, which contain thiol group, will inhibit the development of inflammation. So this is the basic research. And then we are going to the clinical part. And then, of course, some scientists had also done some clinical work. But we tried to try one is called carbocysteine, so 羧甲斯坦 carbocysteine. This is also contain thiol group. And then that's used to be expectorants, so mucolytics, the 祛痰剂. But now we use that as an antioxidant agent in the clinical part. This is produced by Bai Yunshan, so this is drug. And then we designed some research, multi-center, randomized, double-blind, placebo-controlled, parallel study, and 2 arms with 720 patients, quite a large number. So one arm is carbocysteine, 500 milligrams 3 times a day, and placebo, the same thing, 3 times a day. The so-called double-blind, neither the patient nor the physician know which one you receive placebo or carbocysteine. And the result is we are quite happy about the result. This is a cumulative frequency of exacerbation, 急性发作频率 over time here. So you can see this is the placebo group, and this is a treatment group, and really reduce the exacerbation. And also the quality of life is really also improved. So the conclusion of the regular use of carbocysteine for 1 year, what happens to those patients? Significantly reduce the frequency of acute exacerbation of chronic obstructive pulmonary disease, reduced by nearly 25%. So, and also significantly improve the quality of life in the chronic obstructive pulmonary disease patients. That's the second point. And also, it is quite safe, no apparent side effect. And this is the result from the clinical part. So we have finished this clinical part and then published in the Lancet, the New Year Dao, and we call that as peace study. So effect of carbocysteine on acute exacerbation of chronic obstructive pulmonary diseases, and then the randomized placebo-controlled study, which is designing so quite well, so will be accepted by this top journal. So, and also in the year 2009, this paper was elected as the best paper of the year 2008. So this is what our thinking, from the basic research to clinical practice. Even in our part, in each laboratory, you have to think about not only doing basic research. We're trying to find out what's the clinical significance for your basic research. So, lastly, I would like to talk how to learn the internal medicine. So, this is the principle. So, the principle, if you have history, and physical checkup, and laboratory examination, and imaging examination, first of all, you should think about the common disease. This is the first time. So, the most common disease, which one is the most common disease? Not going to the rare disease first. First, what's the common disease? This is first the thinking way. And the second thing is just to interpret all kind of symptoms into one disease, the so-called monism, one disease. Explanation should be attended in application this as one disease. Try to do that, not to set up a lot of diagnoses. Yeah. And also, of course, exclusion method is used for differential diagnosis. Yeah. And also, I've been emphasizing the thing. Efficacy is crucial, critical in assessing the accuracy of diagnosis. Okay. This is some principle. Just give you one example. That's 5 years ago. I accept a patient in the outpatient clinic. He just referred from a large hospitals and tell me, and he was diagnosed as sinus bradycardia, 心动过环, as a heart disease. He had heart disease. And the second, he had iridocyclitis. So this is so-called 虹膜睫状体炎. And the third one is he had found a tuberculosis, mediastinum lymphadenitis. Sorry, lymphadenitis, right? 淋巴结炎 淋巴结核 lymphadenitis. So this is the third one. And the fourth one is renal calculus. So, and the fifth one is the multiple subcutaneous nodules. And that's, and so I can't remember. So with the 12th diagnosis and coming to me, and I collect all the data and make some examination, in particular make some biopsy, 活检, and eventually I make a diagnosis. This patient actually is a sarcoidosis, 结节病. That's the whole the manifestation in the whole body, all showing that the things. So actually it's one disease. Just try to interpret the whole symptom as one disease. This is the best way. But of course, in some of the patients, it's impossible to diagnose as one disease. But usually we should do that. Yeah. So the second part is that we are dealing with disease or dealing with the patient. That's the most important thing. So this is, as you know, the disease are learned from the books. But the doctor are facing a patient in the real world. So, and also, so in other words, that means attention should not only pay to the diagnosis and treatment of somatic disease. So this is very often we met, in particular nowadays in the society, a lot of factors come in and interfere the disease. But also we have to pay more attention to this patient's mental status, 思想状态, and then psychological management, psychological status, and in order to eliminate the patient's worry about, he was all worried about the doctor giving him too much treatment, or he was worried the doctor underestimate his severity of the disease. So the trust from each other is extremely important. So nowadays the so-called 医患关系紧张, one of the reasons, just one, is we just try to communicate from each other, to trust from each other. That's the most important for me. I make some inquire or check up to the patient. I always keep a very kind and very friendly mind to the patient. That's extremely important. And also, but attention should be paid to the so-called interaction of the different organs. For example, chest pain. You can have a lot of chest pain. Will be lung, will be heart. So in the Chinese traditional medicine, they call 肺和大肠相表里. It's a linking between lung and large colon. Seems to be very ridiculous, but it's true in some natural way. In particular, if the patient had constipation, that 便秘, it will cause a lot of breathlessness, 气促. If the constipation is solved, and the patient's dyspnea will be solved as well. So this is something we need to collect, to link between different organs. So also the patient should receive individualized treatment. So auxiliary examination should be used correctly, and also we now the very important excessive auxiliary examination should be avoided. Okay, so I just give you a break. So we start next. Okay.